All right, to start it off, we're going to talk about how to become a paid member. So it can be done in 4 of these steps. The first step will be to fill out the PPS membership form, which can be found in our emails and on the website. Step 2 would be to pay the membership fee on Venmo at pps@uci. You can pay for 1 quarter, 2 quarters, or 3 quarters from $15 to $20 to $25. Step 3 will be to email our IVP, Allie Mills, at her email right there. To find your pickup or ship time for the member exclusive t-shirt. And then number 4 will just be to view your stamp count on our virtual stamp sheet for goodies and like other prizes.
So up next, we have the PTCB question of the week. So these will just be questions, previous questions that were from the Pharmacy Technician Certification Board exam. And these are just like a great way to get a feel for the type of questions that they'll ask when you take the exam and just for preparation. So this week's question is, you have received a script that reads 2 GTT OU BID. What will the label placed on the patient's packaging read? Is it 2 drops in both ears 2 times daily, 2 drops in both eyes 2 times daily, 2 drops in the right ear 3 times a day, or 2 drops in the left eye 2 times daily? So we'll launch a poll and you guys can select your answer and we'll give you a minute. Okay, so 100% people said B, which is the right answer. So just to explain it, GTT is drops, and then OU is just for both eyes. So the way I remember it is O is eyes, and then A would be ears. So for 2 drops in your ear would be A, and then BID just means twice a day. So yeah.
Quick thank you for everyone coming out to our week 2 general meeting with Dr. Mark Bahe and Ms. Janelle Ogston, meeting on hospital and inpatient pharmacy. Really fun having everyone there and participating.
Hello, everyone. So the first episode of the ZOTRS podcast is out. And for this episode, we have recent alum who is also Alex Treverdian, who is also currently a P2 pharmacy student at USC Pharmacy School, and also the president of Anteaters in Pharmacy, to share his story with us. So if you want to see what Alex has to say on his journey, you can check us out in these 8 major podcast platforms of Spotify, Apple Podcasts, Breaker, Castbox, Google Podcasts, Overcast, Pocket Cast, and Radio Public. If you have any questions or concerns, please feel free to contact me, the program coordinator for the podcast, Brian, through email at kwokth@uci.edu. And as always, stay tuned for our announcements.
So an upcoming event that we have is our week 3 after social. And so this will take place right after our general meeting today at 7 p.m. And we'll just be playing like a few games of Scribble.io, which is, if you don't know, is basically like Pictionary. So if you want to, feel free to stick around after our general meeting and chill with us. And as a bonus, the Scribble winner will receive a PPS stamp. Another upcoming event that we have is our week 4 general meeting. And with Halloween approaching, we'll have our Halloween social. And this will take place on Wednesday, October 28th from 6 p.m. to 7 p.m. at our usual Zoom meeting link. Why you should come? You can come to hang out with your fellow PPS members and relieve stress before midterms. If you're interested, paid members will receive a stamp for attending. And if you have any questions, comments, or concerns, you can contact our external vice president, Dana.
So we have a volunteering opportunity here called Be My Eyes. What is it? It's pretty much just an application on smartphones that are used to help the visually impaired with simple daily tasks, such as reading labels or checking expiration dates. You can participate in this anytime you want. It's just on your phone. Once you download the app, they'll give you a notification if anyone requests for help. Why should you use it? It's because you could use your ability of like vision to help other people who lack that eyesight. And it's also to volunteer your time, even though it is virtual. If you're interested, just feel free to download the app. I'm pretty sure it's on both Google Play and the App Store. And then paid members can receive a stamp by filling out the Google form and sending a screenshot of your account by October 21st, which is today. And if you have any questions, comments, or concerns, please contact our president, Jenny Nguyen, at her email.
Hi, everybody. We have an upcoming event. It's our Western U virtual visit. It's going to be on Saturday, October 31st from 10 a.m. to 12:30 p.m. There will be a Zoom link provided to those who click on the interest form and sign up. Why should you come out? Well, you can learn more about their PharmD program and you can get your questions answered by a panel of current students and alumni and some cool representatives. If you're interested, please fill out the Google form by October 28th at 11:59 p.m. and all paid members will receive a stamp for attending. And if you have any questions, comments, or concerns, please don't hesitate to reach out to me at my email address there. Wait. Also, another upcoming opportunity we have is our board intern program, as I mentioned last week. So who can apply? It's any interested paid members. And what can you gain from this experience? Well, this is a really cool way to earn leadership skills and build your teamwork skills. You can get experience in planning different events. You will be sitting with us during our board meetings, helping us plan our activities and our events, as well as have a set for you to do as well. If you're very interested in this program, you can find the application in our weekly emails and in our website and such. The deadline to apply is November 4th, 2020 at 11:59 p.m. We do have a promo video for you to watch. If we could play that, that'd be good.
The sound off.
Sorry, you guys not able to hear it?
Yeah, I don't
I
think
think you'll have to share with the sound. Maybe, did you share it with sound when you first started?
I believe I did, but okay, let me try this again. Sorry, guys. Okay, hopefully now.
Hi everyone, my name is Ali and I am your internal vice president for PPS this year. Today I just want to go ahead and talk about our board intern program. The main purpose of this program is to help those selected members gain leadership experience and take a dive into what our board members do behind the scenes. You may catch us at our general meetings or see us hosting some really fun events throughout the year, but you may not get to see how we go about planning for them or what those positions are even responsible for. In this program, you will be joining us for our board meetings, helping us plan events, as well as getting the opportunity to host your own events amongst your fellow board interns. This includes a fundraiser, a social, and a volunteering event. This program not only equips you with leadership experience, but you also build meaningful friendships and connections with your fellow peers along the way.
Hi everyone, my name is Clayton and I was one of the board interns last year. From the board intern program, I was able to gain leadership skills through helping the board host and plan various PPS events. Through this, I was also able to learn more about how an organization like PPS functions behind the scenes and also gain more insight on what each board member does and how they work with one another in order to create these wonderful events.
Hello, It's nice to meet you all. My name is Christine Chan, and I'm your current publicity chair. Last year, I had the wonderful opportunity to become a PPS intern alongside my fellow interns, and I'm here to tell you a little bit more about my experience. So my most memorable experience was our first project, which was planning a fundraising event. And my fellow interns and I decided to make spam musubi. And with the help of some board members, we whipped them all up at my place and had a blast. Overall, I think it was the interactions I had with everybody that made this particular experience most memorable and enjoyable for me.
Hello everyone, my name is Harold and I'm your historian for this current year, as well as being a former board intern for the previous year. So one task that I really enjoyed that was assigned to me was being a lead for one of the PPD sponsorship dinners. For the sponsorship dinners, we had to go with the representatives to have dinners along with the attendees. So with that, I was able to branch out and get to know the representatives as well as how their program works for their schools, as well as just be able to have a fun time with everyone. Because who wouldn't want to network, have free food, as well as learn more about the school you want to attend.
Hi, my name is Ryan Kwok, and I'm your fundraising chair for PPS in this academic year and a past intern last year. My number one advice that I give to new incoming students is to grab every opportunity you can and find yourself through the process. Being an intern is part of your route to become a more all-rounded person in a professional manner. From improvements in communicating to leading the team to help PPS, I cannot further emphasize how much of an opportunity this is for personal growth and development. Besides, you can take a look at how us boards do things behind the scenes so you can get another perspective of the PPS family.
If this program is something that you're interested in applying for, please complete and send out your applications to this email below. The deadline to submit your application is on week 5, October 25th, 2020 at 11:59 p.m. If you have any questions or concerns, please do not hesitate to reach out and contact me. We look forward to receiving your application. Thank you.
And just to follow up from that video, thank you, Harold, for making it. It's really cool. The deadline on that video says October 25th, but it is actually November 4th. So just a heads up, and we'll try to clear that up, and this will be posted on our Facebook page and stuff tomorrow. Thank you. Hello again. An upcoming event that we have is our USC virtual visit. This is going to be on Saturday, November 7th from 10 a.m. to 12 p.m. And also, again, this will be via Zoom. So the link will be sent out to those who fill out the interest form and come and sign up. So why should you come learn more about the PharmD program as well? Again, you get to interact with students from USC and their representatives. If you're interested, please fill out this Google form by November 4th at 11:59 p.m. and paid members will receive a stamp for attending. If you have any questions or concerns, again, please reach out to me, your IVP, at the email on the slide. Thank you.
Hello everyone, it's me again talking about PPD. I think you heard Harold say there's free food at PPD, but it's online this year, so there's no free food. Sorry about that. Well, why should you come anyways? Well, it's a great event to network with all these pharmacy schools throughout the nation that want to talk to you, our prospective pharmacy school students. This is a great way to interact with your cohort as well as get to know these people that you'll be working with for years to come in the future. If you are interested, please fill out our Google form on our slides or contact me at tylerdt1@uci.edu for more questions.
You can stay connected with us by following our socials below. We have a Facebook page as well as an Instagram, and you can check out our website to find any upcoming events that we have. And we also have a Zoom study room that will be open if you want to just chill and have other people to talk with or just study with. And lastly, we have our Discord server here. Just a heads up that we will be transitioning our after socials to Discord after this week. So make sure to join if you would like to hang out with us.
And now to introduce our guest speaker for today, please welcome Dr. Micah Hata.
Hello. Okay, let me share my screen. Okay, so today we're talking about the outlook of the pharmacy profession. So I'm Dr. Micah Hata, came to speak to this group last year. I'm an associate professor, pharmacy practice administration at Western University of Health Sciences. I guess background is I graduated from Western in 2007, did a one-year residency focused in community pharmacy, and then started teaching right after that. So I've been at Western maybe for over 10 years now. Have a couple practice sites at a couple different community pharmacies. So one is out of Ralph's Pharmacy, so Ralph's grocery stores. Not all of them have pharmacies, but I think there's about 70 different stores that have pharmacies. And so practice out of there, providing travel vaccinations, diabetes education, and then out of our pharmacy on campus, we have a pharmacy and we do diabetes education there. We titrate insulin. So patients who are on insulin, we adjust their doses. Patients who are on blood thinners or anticoagulants, we draw their blood or take their blood and adjust their doses for warfarin. So do a lot of interesting things out of the community pharmacies there. Today, I'm going to talk to you guys about the outlook of the pharmacy profession, which is a pretty broad topic, we'll try to talk about some of the things that are going on, some of the changes that are taking place in pharmacy, as well as some of the things maybe to look out for and expect and see the direction that pharmacy is moving in. Okay, so these are some of the things that we're going to talk about. What is the current outlook for the profession? What are some factors that might contribute to changes in the profession? What does the job outlook look like for pharmacists, which I guess is especially relevant to you guys who are thinking about going to pharmacy school? And then what advice is there for future students to explore pharmacy further or prepare yourself for pharmacy school? So let's start with an activity, 2 separate questions, right? So why are you interested in pharmacy? Is my screen paused?
We can still see it.
You can still see it? Okay. So why are you interested in pharmacy? And then what concerns do you have about a career in pharmacy? So I think we're going to chat in there, yeah, what the poll looks like, and then I'll pull it up. But while I'm pulling it up, if you guys want to respond to the first question. So why are you interested in pharmacy? Let's go. Didn't pull it up. Give me 1 second. It worked earlier when we tested it out. Okay, there we go. You able to see it now?
Yes.
Yeah.
We can see it.
Okay. And is it letting you type stuff in? All right, there we go.
Yes, it is.
Nice. can see some of the responses that are coming through. So interest in medicine, how they work, specialize in healthcare without being an actual doctor, working directly with medications. Okay, so pretty similar responses. And then next question would be, what concerns do you have about a career in pharmacy?
Is anyone seeing the question on the poll? Or...
No, I'm not.
Dr. Hata, we're only able to see the previous
Oh,
question.
the first one?
Mhm.
Okay. Let's see. Stop sharing. Try again. How about now? Still?
We can see the question on your screen that you're sharing, but on
But
our
not
side,
on your
yeah,
end?
yeah, it just shows the past question.
I sent a link in the chat, and I think that should work.
Okay.
Can someone
Okay, Tyler,
check it,
links
please?
work.
Hold on,
Yeah.
let me go
Yeah?
previous.
Okay.
It's good.
Oh, yeah.
Yeah?
Yeah.
Okay,
Thank you, Tyler.
thanks, Tyler. All right. So bad paying jobs, job outlooks decreasing, automation. So oversaturation, lack of positions, not enough jobs. Okay, that's an interesting one. Huge variety of jobs that might be difficult to choose which one you want. All right, so, okay. So I think pretty similar responses, right, for what concerns people have. Let's go back to the slide. And I guess one of the things is like, what have you heard about what pharmacists do, right? So there are some things about what everybody thinks you do in terms of like, okay, so you just stand behind a counter and count, right? What physicians think you do versus maybe what your family members think you do, versus how pharmacists actually themselves perceive, what are things that they do. And so a lot of it might depend on what area of pharmacy you go into, right? That there will be different things, different responsibilities, different roles that you have depending on what you do. I think there's a definite overall perception of what people think of when they think of pharmacy. And so if you're not familiar with all the different careers that you can have as a pharmacist, then you may think, okay, community pharmacy or hospital pharmacy, but there's a whole bunch of other things that you could potentially do with your pharmacy degree. I think that's why it's important to be part of these organizations, right? Because then you get exposed to that as much as possible. All right, so some other things that you probably have heard about, right? Since there was a lot of concerns about oversaturation and the job outlook. Independent pharmacy. So independent pharmacy used to be a huge part of community or outpatient retail pharmacy. But what you're starting to see with independent pharmacies is that there's reduced profitability per prescription that they're making, and just in general, because even what the insurance companies say they'll pay the pharmacy, they end up clawing back money when they actually pay them their checks, which reduces the profitability even more. On the other side, health insurance companies are steering patients to mail order, right? And encouraging them to get mail order. you'll see things like health insurance plans offering patients medications pretty much for free, right? They're saying you don't have to pay a copay when you get it through mail order, whereas if you go to a pharmacy, you're going to have to pay a portion of the cost of the drug, right? And so patients are looking at that and they're like, okay, I'm going to go to mail order, right? And so there's reduced business to independent pharmacies. So you're starting to see a trend where independent pharmacies are starting to close, right? Even if you go work for a chain pharmacy, right, the stress level in some of these chain pharmacies is pretty high. If you work in a pharmacy, like certain pharmacies that may have different colored notifications for medications in their queue, like red is urgent, right? Yellow is you better get on it soon, and green is like you're okay for now. But if you have a bunch of medications that are flashing red, then that means you have a lot of things to catch up on. Right. And so chain pharmacies are raising expectations, not only in terms of how many prescriptions you're expected to fill, but also with the amount of staff that you're given to fill those medications is sometimes decreased. And then the different responsibilities that you have too. So not only are you in charge of filling prescriptions, but you also have to administer vaccinations and try to encourage people to get vaccinated and make adherence calls to make sure people are adherent to their medications and taking them as they're supposed to. So raising expectations, definitely. And this can sometimes lead to increased burnout or stress, right? So decreased job satisfaction, increased turnover. And if you're more stressed at your job and worried about a bunch of different things, could affect patient safety as well. People are saying there's too many pharmacists, right? And there's more and more each year with the number of pharmacy schools that are out there. Right? And so the number of pharmacists that were graduating, right, might not be able to keep up with the number of jobs that are available. And especially if you're in more urban areas, LA or Orange County, right, that concern is very real in terms of getting a full-time position, right? So full-time positions are definitely hard to come by. Sometimes even part-time positions at these bigger companies is difficult. And you may have to float around to different areas, right, and drive farther away to different stores and kind of be flexible with your hours if you want to take a job in a more urban location. And because of the surplus of pharmacists, right, there's concern about a decrease in wages, right? I think we've seen average wages, decrease over the last few years because supply and demand, right? There's a lot of pharmacists out there. And not a whole lot of positions, right, for all those pharmacists. So some of the other things that are driving the concerns for job outlook, somebody mentioned technology and automation, that might be able to replace a lot of what pharmacists do. Mail order we mentioned earlier, so then maybe you don't need your typical brick and mortar pharmacies because we can do so much mail order. I think Amazon kind of tags into that as well, right? If they can deliver medication straight to your door, right, then maybe there's not a need for a lot of our retail pharmacies. Technicians, I think on the one side, expanding the role of technicians is good because then it'll allow pharmacists to focus on other things. There's some states that allow technicians to check other technicians in terms of the dispensing process so that a pharmacist doesn't have to be the final check on those prescriptions, right? It could be a technician that's doing it for certain medications. And so on the one side, I think it's good because it frees pharmacists up to do other things, more clinical activities. But on the other side, right, pharmacists are worried that the expanded role of technicians then maybe means less demand for pharmacists. Consolidation and vertical integration. So what you're seeing is if we're talking about consolidation, pharmacy chains buying out independent pharmacies. And so you're getting parts of the retail market consolidated into these larger companies. You're seeing that with health insurance plans too. Health insurance plans are starting to merge and combine with other plans. And so you're getting consolidation there, which means less competition. And less competition means they have more power in terms of negotiation. So if you're a pharmacist and you have to deal with these larger corporations, it's difficult to get your needs met, right? You have to sometimes bend to their will. And they're vertically integrating too. So what you're seeing with companies like CVS is that they're getting into different areas of healthcare. Like CVS is partnering with Aetna, so they also have their own health plan, right? And then they also own Caremark, so they also own the company that determines how much pharmacies get reimbursed. And so you're getting vertical integration too, because they can only expand so far, right, in terms of buying other pharmacies. At some point, the government says, you're a monopoly, you can't expand any farther. So then what they do is they expand vertically into other areas of healthcare, right? Which means more consolidation vertically and more power to do the things that they want to do. So we saw in one of the concerns, right, the job outlook. I think last year when I presented to this, the job outlook was 0% growth, right? And so when we looked it up recently, it's even worse, right, minus 3%. The employment change over the next 10 years, right, is anticipating a decrease in about 10,000 jobs. If we're looking specifically at retail pharmacy, which makes up more than 50% of all pharmacy jobs, right, the job outlook is worse, right, minus 5% employment change in just that area, right, in just that area of a decrease in 9,000 jobs. So this concern is very real, right, very real. So why should you go into pharmacy, right, why? And what I want to paint the picture for you is that the role of pharmacists is changing, right, and expanding. The surplus of pharmacies that's anticipated by the Bureau of Labor Statistics is based on the current role of pharmacists. And the current role of pharmacists is, you know, providing a commodity. If we're talking about retail pharmacy making up more than 50% of all pharmacy jobs, right, that's primarily based on providing a product, right, dispensing a product rather than providing a service or patient care, right? In a retail pharmacy, what do you get paid for, right? You bill for that medication that you dispense to a patient. You're billing for that product. You don't get paid for the service that you provide, right? But some of that is changing, right? Some of what's contributing to that change is, one is we're starting to see an aging population. So people are on more medications, but when people are on more medications, then and not only are they on more medications and they have more chronic diseases, but you're also seeing the potential for medication-related problems increase, right? So people are on more medications, that's the potential for more drug-drug interactions, right? Potential for more adverse effects, potential for people taking medications to treat those adverse effects, right? And then because they're doing that, then it increases the chance for drug interactions and side effects, and it just kind of compounds that potential issue. Right? And so we are seeing a need for pharmacists to step in and address those potential medication-related problems. I would say an example, right, of the impact of medication-related problems is, if you look at this, right, adverse effects from medications are estimated to be the 4th leading cause of death in the US. How much does it cost, right? It's costing an estimated amount of over $500 billion, right, to treat the adverse effects caused by these medications. And this is avoidable medication related problems. Patients are on insulin, right, and their blood sugars drop too low. They get hypoglycemic, they end up fainting, they end up in the emergency room, right? In the emergency room, maybe they end up in the hospital. Patients who are on multiple blood thinners, right? They get a bleed, they end up in the emergency room in the hospital. That costs money, right? And so these are potentially avoidable medication-related problems that come out to be about over $500 billion a year, right? 75% of hospital readmissions among seniors are avoidable primarily through better use of medications. If people understood how to take their medications properly and adhered to their medications, then we could see a significant reduction in these issues. But if you go to your retail pharmacy, right, how many of them are focusing on preventing these medication-related problems, right? Most of them are focused on dispensing as many medications as possible, right, rather than working to prevent these potential medication-related problems. Okay, and that just kind of paints the picture for retail pharmacy, right? If we look at pharmacy overall, right? And you look specifically at the Bureau of Labor Statistics, number of hospital pharmacy jobs is actually expected to grow, right? It's expected to grow by 4.4%. So in that area, the number of jobs is expected to increase, right? And a number of reasons for this. One is because they're allowing pharmacists to do more in a hospital. So there's a greater need for pharmacists in that area. And on top of that, hospitals are getting into other areas of care. So for example, transitions of care. When patients leave the hospital, right, what happens to those patients? A lot of times, previously, the hospital would be, once they're out their doors, right, we don't worry about them. But now, because reimbursement is tied to readmissions, if their patient gets readmitted within 30 days, the hospital loses all that money that they were paid by the insurance company or the government. So now hospitals are worried about making sure their patients transition out of their pharmacy or out of their hospital to primary care. So when they're going back to their primary care physician or the hospital, they're helping with that transition. And a lot of times that transition is related to medications, right? Are you on the appropriate medications? Are you taking those medications? You know, are there any adverse effects you're getting? So hospitals are starting to hire pharmacists to do that. If we look at ambulatory care, right? Ambulatory care for pharmacy positions is expected to increase also, right? And so here and then in outpatient care centers where physicians' offices are, you're actually, BLS, Bureau of Labor Statistics, actually anticipating a growth in pharmacist jobs, right? So the biggest kind of reason for the overall decrease is the decrease in retail positions. But everywhere else, it looks like there's the potential for growth. Right? If we're talking about community pharmacy, the impact community pharmacists can have could have a significant effect on not only patient care, if you're looking at what they can do to impact diabetes, what they can do to impact blood pressure, smoking cessation, potentially, right? Community pharmacists have this ability to impact. That's kind of what I do on my daily basis. There's a lot of pharmacies that are starting to get into this in terms of actually managing diabetes. Right? We have patients who are on multiple diabetes medications. How do we actually get their blood sugar to be under control? Right? If we have patients who are on blood pressure medications and their blood pressure is elevated, how do we get them to get that blood pressure under control? Right? Like we have patients right now who, they have a glucometer, but they don't even know how to check their blood sugars. Like the time and date on their glucometer is wrong. They don't know when to check it. Right? They don't know what happens if they get a certain number. How much insulin they should be injecting, when they should be injecting it. And so those are things that are beyond just dispensing the product. Once you dispense the product, then it's like, okay, how is this patient using this medication? And are they using it appropriately to the best benefit in combination with their other meds? And so the potential that community pharmacy has could potentially decrease hospital visits, especially when we saw that they contribute to, $500 billion of avoidable costs and overall cost savings. I think one other thing that I want to propose that I proposed last year too is what if every medical practice had a pharmacist? So you're seeing physician offices and physician clinics starting to hire pharmacists to help them manage patients' medications. Simply, one, because they don't have the time to do it, and also because they're not experts in that area, right? So what if every medical practice had a pharmacist? So almost 75% of physician office and hospital clinic visits involve drug therapy. A lot of times those visits are, how is your medications working for you? Do we need to add something, increase a dose, decrease a dose, right? So 75% of those visits are related to drug therapy. And so if every office hired a pharmacist, right? Currently there's about 230,000 physician practices in the US. And if we're looking at the current state of community pharmacists and AmCare pharmacists, and this is from the Bureau of Labor Statistics, right? Currently, there's 183,000 community pharmacists. Currently, there's 13,000 AmCare pharmacists. If we add that up, almost 200,000 outpatient pharmacists. And if every physician office hired a pharmacist, we would have a shortage of primary care pharmacists, right? Or pharmacists in this arena. And right now, right, what we're seeing is that there's actually a shortage of primary care physicians. So that's why you're seeing actual PAs. Their scope of practice is getting expanded. Nurse practitioners, what they're able to do is getting expanded. I think I saw a bill a couple of weeks ago saying that some nurse practitioners now don't even need a physician to supervise them. And that's because the state is seeing that there's a shortage of primary care providers. And so pharmacists can step into that role to be like, okay, we can help you with these patients, especially with the medications that they have. Right. And so we're actually looking at, how can pharmacists be an essential part of that primary care team? You have your primary care physician, you have a physician assistant or a PA, you have a nurse practitioner. But if you're looking at PAs and NPs, they have very limited knowledge about medications. And if most of the visits to these providers are related to medications, there's a definite need for pharmacists to step in and fulfill that need. Right. I was talking to a PA the other day, and I was like, this patient has diabetes that's not controlled. We could initiate one of these newer diabetes medications that won't cause as much weight gain. It'll lower their A1C, lower their blood sugars, right? And they only have to take it once a week. And the PA or NP was like, I don't know enough about that medication to make a decision. So let me find out more about that medication before I prescribe it. But if they had a pharmacist in that clinic, boom, it'd be done right then, right? And we could help this patient get their blood sugar under control. Okay, so why pharmacy, right? If you're looking at compared to a PA or NP, I think there's a potential growth for pharmacists, right? Pharmacists are the medication experts, right? They're the most accessible healthcare providers, especially if you're looking at a community pharmacist, right? And then on top of that, there's a variety of career options, which I think you guys are going to learn about. Right, it's a bunch of different areas that you could get into. One of those areas is industry, right? So I think there's a lot of people that are interested in working for a pharmaceutical company. And I think that's one growing area. And why we're seeing that is because you're getting a lot more specialized medication. There's an actual class of medications called specialty medicine. And these are generally high cost medications that cost thousands of dollars potentially each month. And a lot of times they require specific monitoring, because if that health plan is going to spend that much money on a patient, they want to make sure that you're taking it, right? And so they want a specific monitoring. Sometimes these medications are very specialized in terms of they're for specific individuals, right? Depending on, do you qualify for it because you have this particular gene or because you have this particular lab, right? They want to make sure it's getting to the right patient. So you're starting to see medications for Hep C, right? HIV, cancer, multiple sclerosis. You can see this growth in specialty medications over the next few years. Another group of medications that pharmaceutical industries are developing are called biosimilars. So oral medications are pretty easy to replicate, right? If you're talking about metformin, you can make a ton of generic drugs for metformin. But if you're talking about injectables like insulin or injectables like Humira for rheumatoid arthritis, these medications are more difficult to replicate. And so you can't make an exact copy. And so there are medications coming out called biosimilars, which are very similar to that medication, but not an exact copy. So they have the same effect and they have the same adverse effects, but not an exact copy. And yet, these are medications that will help lower the overall drug cost because it'll make different options available for patients. And so this area of biosimilars is starting to grow too. Within the last few years, this has taken off. And so I think, there's definite growth in the area of industry for pharmacists. I would say another area is for health insurance plans, what we call managed care organizations. So working for a health insurance company or working for what we call pharmaceutical benefit managers who run the pharmacy benefit for these insurance companies, pharmacists work for them to determine, what medications are going to be covered, which ones are not, how much are we going to charge patients for this, how do we determine this medication is most appropriate for this patient, right? These are decisions that pharmacists make for these companies. So let's take cystic fibrosis, right? What is cystic fibrosis, right? It's a lung disease that leads to infections, digestive problems, and the average life expectancy of people with cystic fibrosis is 37 to 50 years, right? It affects a very small portion of Americans. So 300,000 Americans are affected with CF. And most are diagnosed before the age 2, so childhood disease. What kind of treatment is available? So prior to up until a few years ago, the standard of care was just treating symptoms, right? There was no real cure for it. It was just, how do we treat the symptoms of infection and digestive problems? So a few years ago, 2012, here comes Calideco, right? Calideco was approved in 2012 to treat the underlying cause of cystic fibrosis, so not just treating the symptoms, right? So what does it do? It doesn't reverse established lung disease, right? So once your lung is damaged, it doesn't do that. But if you're able to start it early enough, right? If you start it early enough, then it can slow or prevent the progression of cystic fibrosis, and actually cause you to live longer and live a better quality of life. Now, who does it help, right? If we're looking at people with cystic fibrosis, you're already starting out with a small population of people, 300,000 people. Compare that to diabetes, where there's 34 million Americans that have diabetes. So cystic fibrosis affects a small portion of that. And on top of that, right, it only will help 4% of the people with cystic fibrosis. So 4% of that 300,000 is what this particular medication helps. Well, what does it cost? $31,000 a month, right? $31,000 a month for this medication. So if you are working for a health insurance company, do you put Calideco on your formulary? And I was going to have a poll everywhere, but why don't we just chat? So if you are working for a health insurance company or a PBM, right? You're determining, do I put this medication on the list of drugs that our health plan was going to cover? And understand that your health plan is responsible for the healthcare coverage of all your members. So all your members are paying money for you to determine, you know, are we going to cover this medication for 4% of those people with cystic fibrosis, right? When the medication's on the formulary, that means you as a patient, if you're taking that medication, you only pay a portion of that cost, right? So you go to the pharmacy, you pay a $20, $30, $40 copay, right? That's if it's covered. If it's not covered on the formulary and you're a patient that needs this medication, you're going to pay $31,000 a month, right? So what do you do? Why don't you guys put in the chat? Do you put it on their formulary? Yes, or do you not? Right? Yes or no? Go. This is the audience participation portion. Yeah, you guys are like my students.
I just
Yeah,
want to
it's true.
answer yes or no. You know? Like if you really care about patient, not a lot of people can afford that. But like if you put that burden to the insurance company, it's it's not gonna work. Like there's no profit for them as well. So
Yeah. So a difficult decision. So it depends on what side you're at. Okay. So because I only have like 3 minutes, you guys are gonna force me to talk about what those different sides are, right? So if you're the health plan, right, then you really have to take into consideration, does this benefit all our members, right? If all our members are paying a premium, right, each month to have this health insurance plan, right, does it benefit overall, right, our members or society? If you're a paying member of that health insurance plan and you're like, I don't have cystic fibrosis, maybe you're like, I don't think we should cover it. It's going to cost us too much, right? But if you're a patient or if you're the parent of this child, 2-year-old child with cystic fibrosis, and they have that specific genetic mutation, do you want the health insurance plan to cover it? Right? You do, right? You don't want to have to pay $31,000 a month. Right? But these are the decisions that our pharmacists are making. And more, that's becoming a growing area of pharmacy, right, in managed care. And those are decisions that require a clinical pharmacist decision. You have to understand, how does this medication work? What kind of adverse effects is it going to have? How are we going to have to pay money to treat those adverse effects, right? How does the overall benefit in terms of quality of life and life expectancy, how does this medication benefit cost-wise over time, right? And those are things pharmacists are getting into and making decisions about. Okay, so what can you do now, right? Explore all these different career options. The best way to do that is network as much as possible. Even now, you can visit pharmacy associations. even as an undergrad student. I was talking to the California Pharmacists Association, and they were saying undergrad students can pay $35 for a membership to CPHA. And there you can network with other pharmacists. These are really involved pharmacists that are looking to mentor people interested in pharmacy, right? Volunteer. You can find out what pharmacists are struggling with, legislative wise. How do we expand our scope of practice similar to how nurses are expanding theirs, right? Make the most of opportunities available to you. Try to create your own. If you meet a pharmacist, right, ask them, how did you get into your area? What do you like about it? What did you not like so much about your position? How can I best prepare myself for pharmacy? And then research pharmacy school, right? Find out, right? Don't just go to like the closest one to you. Don't necessarily, cost is a huge factor, but also look into, how they run their curriculum. What do students like about that curriculum, right? So research different pharmacy schools and what they have to offer, more than what's, displayed on their website. Okay, so what will help you in the future, right? I think these are some things that are gonna just help you even when you get into pharmacy school and afterwards as well, right? Lifelong learning. Continually develop new clinical skills, seek additional knowledge. We tell our pharmacy students, what you learn now in school is probably gonna change in a few years, right? So make sure that you stay up to date on those things, and then be able to make your own clinical decisions, be able to look at the evidence that's out there, right? And be able to make your own informed clinical decisions. Soft skills. Soft skills are huge no matter what company you go to, right? Your interpersonal communication skills, practice that. How you communicate with colleagues and peers, making sure that you respect them and that you're communicating confidently. And then with patients, making sure that you're empathetic. And we teach students now about motivational interviewing. How do you not convince them to change, but how do you get them to motivate themselves to change, right? How do they find reasons to motivate themselves to change? And then I would say another big thing is emotional intelligence and self-awareness, right? Your own personal growth and development, being able to assess your strengths and weaknesses, being able to learn from your mistakes. I think that definitely helps. Trying to take leadership positions, and even if, maybe you make mistakes in those leadership positions, just learning from those mistakes. And I think the more that you're able to do that and find balance in what you do, then it'll also reduce burnout, and stress. So what do you envision, for the future of pharmacy? Do you think that it will continue to be how it currently is today, right? Or do you think that, it'll change, where pharmacists are getting more and more integrated as part of these healthcare teams? More and more, they're going to be, pictured as providing care as opposed to, and providing service as opposed to being tied to this product, right? One is there's a lot of things that are changing now that are going to contribute to maybe this change in our profession. But another part of it is, we want our pharmacy students to be a part of that change, right? For them to revolutionize and advance our profession. And so there are definitely opportunities for pharmacy students to get involved in that change as well, right? The potential is there, right? And things are moving in that direction. And so that's why I think, right, if the reason you're getting into pharmacy is not just, for the money, but more because you like interacting with patients, or you like dealing with medications, and you like seeing the impact that medications have on a particular patient, on society, or a population of people, right? And if you continue to personally develop yourself, develop lifelong learning skills and keep developing your soft skills, I think there will always be a job for you, right? There will always be a job for those top percentage of pharmacists and pharmacy students. So in that case, right, I think you can continue to be, a part of that, the future of the profession and the growth of our profession. Okay, hopefully I didn't go over too much, but I think that's all I have. Definitely feel free to email me if you have questions. I try to make myself accessible as possible. I'm a part of the Orange County Pharmacists Association. And so, all of our meetings are virtual now. So if you ever want to jump in and see what our meetings are like, sometimes they're not the most exciting, but you can definitely meet pharmacists there. And there are definitely pharmacists that love talking to students. So yeah, feel free to reach out if you want to find out more about, what our profession is doing, what we're doing to change it. And, also in terms of, checking out how do you make yourself a competitive candidate for pharmacy school. Like, I'm willing to help you in those areas too. Thank you, guys.
Thank you, Dr. Hata, for the great presentation. If anyone has any questions right now, you can go ahead and ask them in the chat or go ahead and unmute yourself.
If no one has any questions, so I can go first. So Dr. Hata, I have a question in regarding to, so as everyone know, like how COVID-19 has like significantly affected like our lives, like the public health. I was wondering, so maybe after the pandemic in the future, we may definitely have some more maybe different regulation or prevention for future pandemics. I was wondering if pharmacists have any sort of roles into helping to continue to process the public health regulation and to prevent like such further pandemics?
Yeah, I mean, I think to prevent future pandemics, it's tough, right? Because sometimes like these things pop up and we don't know really what contributes to it. I think we have a pretty good idea, right, of what contributes to the spread of COVID. And so because of that, I think definitely things are going to change just within our own profession in terms of, putting up particular barriers, right? Making sure that, we sanitize like almost every like few minutes, it seems like now, right? And so I feel like those are processes that I think moving forward aren't going to change. But I think also pharmacists being a part of, expanded scope of practice, like vaccinating, right? And when that COVID-19 vaccine comes out, I think a big push for public health is going to be, okay, how do we vaccinate as many people as possible, right? And the other thing is getting pharmacists involved in testing, right? Because pharmacists are super accessible, right? How do we involve them in that testing portion? So if another pandemic were to come out, I think it would be more, how do we mobilize that sector of the profession, pharmacists, to be, so that we can be more prepared for these things, because it took us a while, right, for us to get those things in place. And even then, like testing sites, we still probably have a shortage of testing sites, right? So I think it'll be more like, how do we mobilize that sector of the profession so that we can, make more rapid changes and get ahead of it faster.
How about educating the public about like, certain medications, like on like what works or what doesn't work? You got all these medications that's popping and everyone was like, oh, like I'm going just to take this drug and then then I don't get COVID. Like there's like a lot of these rumors around, right? So does pharmacists have some sort of role to further educate the public, to try to tell the public that not to super panic and like get all these medications, instead to be more mindful and like to use such medication?
I think that's a good point too, right? I think in that case, right, pharmacists should be seen as that expert in the medications, in terms of, okay, like if you have a question about it, from what I'm reading on social media or from what I'm seeing in the news, right, to be able to go to your pharmacist and say, like, what do you think? And I think if you spoke to most pharmacists would be like, there's not enough evidence yet, right? Like, we don't know, right? But yeah, definitely to get that message across to say, hey, if you have that question, right, if you're reading these things, go to your pharmacist and see. Yeah, like hydroxychloroquine, we're seeing like shortages because people are trying to stockpile it. And most pharmacists are like, hey, like you need to be using it appropriately. You can't just be, taking this when there's not enough evidence to support that.
Okay, thank you.
Hi, Dr. Hata. So I guess kind of from this presentation, I feel like pharmacists are being a little underutilized in certain clinical settings. So how do you think that we can advocate for the profession collectively?
Yeah, so I think there's different ways that we can do that, right? One is legislatively. So I think that is one for us to go to the state and say, hey, pharmacists can do this. We have this background, Like I was seeing the other day that the Board of Pharmacy actually published in opioid use disorder protocol. So patients who are addicted to opioids, they can get started on treatment called Suboxone that will help them with their addiction, right? And pharmacists could be a part of that in working with providers to initiate Suboxone faster and get patients more access to it. And so if there were laws passed that would allow pharmacists to do that independently, just like they're able to do with naloxone now when patients overdose on opioids and we can give them naloxone as an emergency rescue medication, I think those are ways that we can legislatively make an impact and expand that scope of practice for pharmacists. And then I would say the other way is just pharmacists in their own everyday practice. So I'm working with community pharmacies that are starting to document what medication-related problems they identify and what they did to resolve those problems. So if you go into your typical like CVS or Walgreens, pharmacists are probably making interventions almost on a daily basis. Even independent pharmacies, you're making interventions that could potentially save medication-related problems, but we're not documenting it. And so I think pharmacists need to document that and communicate that information to the physicians that they work with. Like, hey, this is how we're helping your patients with blood pressure. This is how we're helping them with blood sugar. They need to communicate that to the providers they work with, and then also just be able to document that so that they can show payers, so they can show the government, right, what they're doing. And those are things that we're starting to do now, and we're starting to do a better job of it. And so I think as that builds, then that'll make the case for pharmacists that, hey, we are being underutilized. We actually are doing these things now, right? And so we just need to be recognized that we're doing them.
Thank you.
Yeah.
Thank you, Ryan and Christy, for the great questions. We are out of time now, but Dr. Hata's slides will be uploaded onto our website and included in our email if you want to look over them, and email him if you have any extra questions. Can we please get one more round of applause for Dr. Hata? Thank you so much for taking time out of your busy schedule to come speak to us.
No problem. Thanks for having me.
Alrighty. At this time, we will be sorry, I just muted myself on accident. We will be moving on to our after social. Wrong slide, sorry.